Hi.
Welcome to the office.
Thank you.
Tell me what brings you here.
I have had back pains for, I'd say, maybe like 10 years.
Okay.
It's kind of been since I was younger.
What happened?
I think a few things have happened. I've been in like 2 car accidents that were pretty rough.
Okay.
And then I've been hit on my bike by cars 3 times.
Okay.
The main one was maybe 6 years ago. I was hit by a car that was coming like 70 miles an hour at me, and I sit really close to the steering wheel.
Okay.
But it came right behind me.
So you drive like grandma?
Yeah, but
Okay.
everyone makes fun of it.
All right.
But I didn't get hit by the car because of it.
Nice. Okay.
But I was spun
Good.
around, and then
Good.
someone had to pull me outside of the car.
They use the jaws?
They did not. No, some
Okay.
stranger pulled me out of the car, put me on the side of the road, and then left.
Okay.
And then I was
Nice.
smart because I was like, I'm not going in an ambulance because that's $5,000.
Oh, wow. Okay.
So I had someone drive me there.
Got it. Okay. Okay. What was the big trauma though in your low back?
I don't really know exactly what it is.
Okay.
I was in a car accident when I was little. And then I've just kind of always had this pain, but I can't like pinpoint in my head what exactly it is.
Okay.
Which is kind of frustrating.
Okay.
So,
What are you doing here?
I'm here.
You're here for back pain? You're here for your whole body? What are you doing here?
So I'm here for back pain, for neck pain.
Okay.
Basically, I can't sleep through the night because I wake up in pain.
In your low back or your neck?
I would say primarily in my low back.
Okay.
So I feel like I have to constantly be bending it and twisting it.
Okay.
And then I always feel just tense, like
Do you
almost
feel it
robotic.
on one side more than the other?
Recently, it's been my right side.
Before that was left?
It was general.
General. Does it shoot down your leg?
No.
Any shooting pains down your leg? Any numbness? Any tingling? Any of that?
No, not that I...
Okay. No?
No.
Okay. It wakes you up every night?
In the last year, it's been about every night.
Okay.
So
And that's number one?
That...
The low back?
I'd say lower back, my neck and upper. I broke my collarbone when I was a kid.
Okay.
So I don't know if something just has been weird with my neck, and I don't know if that's associated to it.
Okay. We'll take a look at it. And you're here, you're local?
Yes, I'm local.
You're from LA?
Minnesota
From
originally.
Minnesota.
Yeah.
Okay. All right.
Yes.
How long you been here?
I've been here for 9 years.
9 years. And what have you been doing to manage this pain in 9 years?
Nothing really.
Nothing. You just deal with it.
I've just kind of-
Self-medicate. Ice, whatever.
Not
Jokes.
jokes for sure.
Everyone has a defense mechanism.
Yes.
What's yours?
Definitely joke about it. I think
Okay.
complain about it too, but in a
Okay.
joking way,
Got it.
which might not be super funny.
Can be though.
Yeah,
Depends on your audience.
sure.
Okay. All right. What else? So back and neck.
Back, neck. I recently fell. I was on a hike and I've been having knee pains, and I'm
Okay.
running a marathon in 20 days.
So you're able to run a marathon?
I've run 4 in 2 years.
So how are you dealing with all this if you're in so much pain? You
I
just
say it's fun,
got it. So pain is your fun story now.
apparently.
Okay. Left knee.
Yes.
Okay. You twisted it?
I fell on my kneecaps on rocks.
Both of them?
Both of them. This one has the cosmetic, but this one, and I've been to a bunch of doctors.
Tender
and,
in the back here?
Yeah.
Okay. How
And-
about back here? Nope.
No.
Okay.
And I've been to acupuncture, and
Okay.
everyone's just like, we don't know.
Okay. But it still hurts.
Oh yeah.
And in terms of back pain, neck pain, what have you been doing? Like, been to a chiropractor?
That.
You're self-adjusting?
Yeah.
Okay, so you have a lot of hypermobility then.
Yeah, and I'm hyperextensive in my elbows.
Got it.
So
Okay.
they do this.
Whoa. That's kind of cool.
Yeah.
What's that tattoo of?
It's an airplane.
What kind of airplane?
It's a 1920s airplane.
Interesting.
Yeah.
Looks like one of the ones Gonstead used to fly. Gonstead was a pilot.
Oh, really?
Flew a plane like that.
Huh.
Yeah.
That's what this tattoo is.
We're going to put G-Force on the bottom. Okay.
It's your new logo.
All right, so here's what we're going to do. I'm going to have you walk.
Okay.
All right, we're going to watch your gait. As you're walking, we'll walk and talk.
Okay.
Okay, and then we'll do the exam and go from there.
Great.
Can you stand up for me, please?
Yes.
I'm going to tuck the back of your gown.
Perfect.
What I'm doing is marking the...
Is that a knife? What is that?
Come on now. Okay, go ahead and walk away. Keep going. So you're going to walk several times back and forth.
Okay.
Keep walking. So we got a little bit of a waddle, not so bad. Now walk on your toes, please, for me. Good. Turn around, walk on your heels. You can see that right pelvis just kind of sticks up on the right side. Okay, have a seat, please.
Another thing too,
Yes, ma'am.
when I sit like this, it starts to hurt like within 2 minutes.
Okay,
So I feel like I always need something that's like doing this. But,
correct, because we need to get extension in your low back.
okay.
All right, so what's happening here, there's a pretty serious situation going on in her sacrum over here. And it looks like down at S2, S3, there's a lot of posteriority. There was a bad fall there on the sacrum, on the tailbone, correct?
Yeah.
And she's just kind of been dealing with it all these years. And it's been there a while. It didn't happen just yesterday. Scoot forward, please. I'm going to have you touch your toes. Bend forward, touch your toes. And let's just get an overall look of the spine here. Not so bad going through here. We have a little dishing there, tender there.
Yeah, a little bit.
That one
Yeah.
or that one? Okay.
All of them.
All of it. It's a little dishing there. Come on up slowly, please. Let's run the meter on your back. Let's do it.
This area right here
Mm-hmm.
feels like I always need to dig something in it.
This part here, right?
Yeah, like it's like here, kind of.
Okay. So we need to talk about the sacrum. We need to talk about the lumbar spine. This is the major thing that we're going to need to address and correct in order to get you back to balance, okay?
Mm-hmm.
So a couple of things going on in the sacrum, but before we go there, let's talk about what we see on the meter. So we're getting a small, oh, there it is. Started out small. Started out balling, ended up hustling. Started out at 5, became 18. There we go. So we're getting about 17, 18 points of pressure on the left atlas. So what else? We're
Okay.
getting about 10 points around T4, 8 points. There we go. There it is. Let's continue through. All right, let's continue all the way through. Mid-back is nice and clear. And now when we get down sacrum, now here's the thing. The meter is reading inflammation, right? This thing has been there a while. We're gonna find it there, but we're not gonna get a huge reading down here, like 20, 25. I don't see that, only because it's an old injury that's kind of been compensating over the years. So we got about an 8-pointer, 10-pointer, about an 8-pointer here, and we have about a 18-pointer up top in the atlas, okay? So let's static palpate, follow my fingers. You can see right there the tissue changes, orange peeling. Right there. Tender.
Ah, yeah.
That's the one. That one.
Yeah.
That one. No. Starts
That one.
there, but that
Yeah.
one is sharper.
Yeah.
Head down, please.
What's that?
That's 7, that's 1, that's 2, that's 3, that's 4, that's T5.
Really?
Now let's check motion of the pelvis. Watch my thumbs, feet together, open and close the knees. So what we're checking is the motion of the sacroiliac joints. They should move together. When we do one side versus the other, the opposite side should be independent. Do the right side only. So when she does the right, not a lot of action on my left finger. Left one is fine. Do the left side. But when she does the left, this thing wants to shift. So we're getting fixation right there on the right pelvis. Do you feel that?
Mm-hmm.
Yes, ma'am?
Mm-hmm.
All right, just checking. Scoot back for me, please. So we're getting the right SI joint. Right SI, you can see it's higher, riding higher on the right. Now, what we want to do is check the top of the joint. Follow my thumb here. This is the top, middle, and the bottom of the SI joint. That's where she's tender. And that makes sense with an AS pelvis. When it goes subluxates up, it's going to cause pain, irritation, swelling, and restriction on the bottom part of the joint. You feel that?
Mm-hmm.
But look when we go up top here. That's moving, okay? That's not. So, fixation, restriction, bottom, posterior lateral aspect of the PSIS. You know what a PSIS is? Posterior superior iliac spine.
Okay. I still don't know what it is.
It's the bump. It's just the name of the bump.
Okay.
Okay? I call it the dimple.
I named it Henry.
I call it the dimple. These are called the official terminology is PSIS, posterior superior iliac spine. Now let's get to the sacrum. L5, S1, S2, S3. That's where
That's
it
fun.
is. S3.
Oh, thank you.
All right, so S3, right pelvis, T4, left atlas. Let's check the shoulders. I'm gonna do circumduction, a little baseball style pitching.
Cool.
Checking for movement. Movement is good on this shoulder. Let's check the left side. Let me do the work. Movement is good. Go on your back. Let's check the feet. Let's check the knees. We're gonna check tracking of the patella.
Okay.
So patella is formed by, we said we had some knee issues too. You fell on, so let's see what the issue is. Femur, tibia form the patellar groove. We want to make sure the tracking is good. We want to make sure there's no clicking. Okay? So forward, down, flexion, extension. Valgus varus stress, all good. Let's do valgus varus stress in extension. If it opens up more on the outside, tibia. Opens up more on the inside, femur. Tibia.
Ow! Don't do that.
That's tibia.
Oh my God,
Look.
you're gonna get kicked. You're in a very vulnerable place. Oh, God.
So she's got a lot of gapping on the lateral aspect. There's the lateral meniscus on the back side, and if I push, there's a little bulge on the back, right?
Yeah, that's Charlie.
There, okay? Now let's do this side.
It's the bad name. Oh.
But the tracking is decent.
Okay.
The tracking is decent. Let's do valgus varus stress. This one's worse, right there.
Oh, stop.
So we have bilateral posterior tibs. Predisposed, though, guess where this is predisposed from? The sacrum. So you feel the knee, I get it. You fell on it, I get it.
Yeah.
After we do your sacrum, though, you're going to tell us what the difference is.
Okay.
So
Can you physically see the house?
Yeah.
Can you see? You can see the difference in the knee,
Yeah, it's swollen.
Okay.
It's rotated.
but like,
This side's not so bad.
I
It's a
mean,
little tender.
sure,
But
but
this side,
yeah.
for shizzle.
Okay. Thank you.
Yes?
Appreciate you.
Yeah?
Thank
Hey.
you.
So, talus. She's got an AS talus, medial
Oh!
tilt. That's the point tenderness. Check her out, dude. All right, jokes aside, walk it off.
Okay. Oh, so a marathon
Walk it out.
in 20 days is good.
Do you want me to talk about the sacralization?
This thing.
The sacrum?
This?
The
Yeah,
X-ray?
absolutely.
You want me to? Sacralization is when the lowest lumbar, L5, takes on the characteristic of a sacrum and it kind of fuses together over time. So we have 4 true lumbars.
Okay.
Now, lumbarization is where the first sacral tubercle takes on the characteristic of the lumbar. That person appears to have 6 lumbars. Stand on the black platform.
Okay.
Face down, fire in the hole.
Oh,
Enjoy the ride,
thank you.
and we'll see you on the flip side.
Oh, what?
Are you taking the red or the blue pill right now? That's the question.
Oh, I don't remember which is the good one.
Which one?
Blue.
What's the pill? Johnny, what's the pill?
He doesn't know.
The blue.
The blue?
He's just
I don't
saying,
remember.
but I don't think anyone does.
All right, so do you want the truth or do you
Yes.
want to go back to the life you were living?
I want the truth.
Let's do it. Slide out.
Okay.
Okay, turn your head to the left.
To the left.
Yes, ma'am.
To the left, to the left. Everything you own in the box to the left. I'm very scared.
You're scared of what?
I don't know. My face smushing. Ow! What the heck is that?
That was an ear adjustment. I just kind of threw that in.
Thanks. Oh my
That's
God.
a home run, lady.
Oh, you didn't even count or anything.
I don't have that luxury.
Oh gosh. That's it, right? We did it? We did it.
You okay?
Yes. Okay, what's
Shoulders
happening?
down, shoulders down.
Okay.
Down.
I like communication.
Okay, so we're gonna set T4. 1, 2, 3. I mean T5. T5, setting it as a PLS.
Oh God.
Oh wow, you're tight.
Yeah.
You're very tight.
Did you get it though?
No.
Oh, I felt something.
No, that was relax.
Okay.
Do I gotta fix the also?
No, I like it. Oh gosh.
Gotcha. I have a couple of patients, instead of yelling, screaming, and crying, they laugh a lot. So that's good.
Uh-huh. Is
Okay.
it delirious?
That atmosphere was pretty intense. Walk
that the
it
neck?
out. That was the neck. Seriously. Breathe. Okay. Keep breathing. And now, all good, lady?
Mm-hmm.
Left side down, please.
Left side down.
Yes, ma'am. Bottom leg straight.
Bottom leg straight.
Top leg bent. Slide your whole body forward.
Okay.
Keep going. Okay, so we're going to be on S3 now, okay?
Okay.
Butt forward. There. You good?
Yeah.
Hold there.
Okay. Oh gosh.
I'm not dropping you.
Okay.
If I drop you, I send you to Hawaii.
Ooh, fun.
And I did not slap her butt. Someone made
Yeah.
comments of that. I'm
No,
tapping
it's
the
my
side,
hip.
okay?
It's my hip. We're all good.
No, because people make comments. Why is he slapping
Slapping
his
a-
patient? Well, I'm not slapping no butt. It's like, get over it, people. Relax there. I'm just getting everything set up. Relax, relax. Shoulder up, 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 up. There you go. So we're going to be down here on S3. S1, 2. She got a little tail there, you can see. And S3, I'm going to do it as a push-pull. I need you to hook your ankle behind the knee. Straighten out the bottom leg. Straighten it out. It's okay if it goes forward a little bit. I just want it straight. The idea here is you can see now for her, this leg should be on the table. But if I put it on the table, she's in too much extension. I kind of want it flat like this for the S3, okay? So the idea is patient positioning and neutrality of the segment you're adjusting. So I'm right here, S3. Shoulder up. She's pretty flexible there. Now, we need to come through it this way, okay? Let it roll. Good.
Oh.
That was a great miss. That was a great miss. That's for the blooper reel. All right, we're thinking too much. Stop.
Okay.
Stop thinking so much,
Okay.
please. That's still not it. No,
It
that's
didn't
strike
feel
two.
like it.
Let's go other side, please.
Okay.
That's strike 2. Nope, right side. Head over here.
I got confused.
Head on your side.
Okay.
Face me.
Facing.
Okay. Let's regroup.
Okay.
Focus on the breath. Focus on the breath. Bottom leg straight. Okay. There you go.
Learning.
Tuck. Try not to help so much now, please.
Sorry.
Got you the whole way, okay. And if I try to do her sacrum on the high-low, her feet will end up being vertical, so we don't want that. Relax this shoulder up, up, up. There it is. Good?
Mm-hmm.
Gotcha. Gotcha. Now, what's different in your S3, because there's a lot of callus formation in there. It's been there a while. we're gonna be moving through it. It moved.
Yeah.
Stand up and walk, you'll see the difference. But we're not gonna get that huge audible yet. It's gonna take a few.
Okay. Ooh.
Okay?
Yeah.
Walk it off. Tell us what's different, please. No
I
good,
feel-
no bad, just different.
Just, yeah. I feel just kind of like jello-y. I don't know. It feels like lighter, airier. I don't know
Okay.
what the verbiage would be.
Can we go deeper?
Probably.
Face down. So, throat is clear.
Uh,
Okay, we're going to use the cervical strap for stability. What do you think, Johnny? Okay, now knees apart. Tummy down to the floor. Tummy all the way down.
Oh God, I'm scared.
Okay, you're good. Now you can see she's a little off there. I'm right on S3. Bring this in. There we go. Oh, there it is. Good. I'm going to be over here. I'm here on S3.
Oh God.
No, tummy down. Down. The more you let this hang, guess what? The easier it is, the less force. There it is. Good. Gotcha. That's it. Gotcha. 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 I got you. Don't worry. I got you. That's it.
Oh.
That's the worst of it, okay? Give me your hand. Give me your hand. I had to do it. It's okay. Are you okay? Did I hurt you bad? Just
No.
sure? Did something flash?
Oh, no.
Walk. Just walk. Just walk. It's okay. Just walk. Just walk. You're strutting now. Walk it up. Let's see the dimples now. Something had to come out.
Yeah.
You're okay though,
I'm
right?
okay, yeah.
Get over here. Get over here. Let's watch. Okay. Walk. Es muy diferente. Told you something needed to come out. Seriously. So can you tell me what happened there? Can you tell us what happened? Did you get hurt? Did something just come out? You just
No.
had a sudden release of something?
Yeah, I mean, it's not like a pain hurt. It's like it's like a release. And then I think it's just been like built up for so long.
Correct.
And I don't think I've ever been able to feel a release there.
Okay. Did you feel the release today?
Yeah.
Okay. Neck is clear?
My neck's clear? Oh, because you did it earlier.
Yeah. T5 is clear?
I still feel it.
Yeah. But watch this now. You want to see them scoot forward? It's going to be like the Matrix now. Watch this. All the way back. Do it again. You feel that?
Nothing.
Right?
Yeah, it's fine.
All right. Scoot back for me, please. Shoulders are fine, we said. We're going to work on your knee. On your back, please. I'm gonna just start the knee process. I'm not gonna go aggressive on it because we did a pretty deep set on your sacrum.
Okay.
That's gonna affect the mechanics of everything.
Okay.
Go on your back though. I wanna just humor me for a second. I'm gonna do that valgus varus stress. I'm sure something changed. Go on your back.
Okay.
Check it out. Check it out, Johnny. Valgus varus stress was opening a lot on the outside. Tell us.
Yeah, it doesn't hurt like it did. I was gonna punch you earlier.
Yep. Check it out.
Okay, this was the really bad one.
I know. I mean, it's still tender, but watch.
That's crazy.
Okay?
It doesn't hurt.
Got it. That was all sacrum. Now, we're gonna just lightly set the tibia with the board.
Okay.
Just to get it moving on the back. I'm on the back side of the posterior lateral capsule. Relax the knee. That's it.
It's just scary. It doesn't hurt or
Ankle.
anything. Yeah, it doesn't hurt.
Ankle.
I always thought this would hurt.
Stand up.
You don't want to do this.
It's a Hollywood, girl. Squeeze. Squeeze. No, I don't want to.
Ah! Okay. It's just shocking. Don't get mad. It's shocking. It doesn't hurt. It's just shocking. Ah! Okay.
I don't. Easy.
It's just, sorry.
Timber wolf. You a timber wolf?
No, I'm a twin.
Oh, twins.
The Twinkies.
Okay, relax. There. Squeeze. Relax.
Okay.
That's it. Okay. One more on the thumb.
Okay.
Squeeze. Let's go do your nose. Oh. On your back. Slide up. So it's curving this way. High side of the rainbow is on the left side. So we're going to come in from the left side.
Oh, gosh.
Still Rahim, my name, okay? Okay, so we're going to come in. We're going to take the nose all the way over. We're going to set it that way.
Oof.
You okay?
Yeah. Oh, gosh.
That was a home run. Dude, that's set. Awesome.
Oh.
Nice. There was an audible on that one.
Sick!
She can breathe again. Seriously. Walk and talk.
That's crazy.
Walk and talk. I just gave you a $5,000 nose job.
Ooh.
You're welcome.
My sister's
You're
going to be
welcome.
so jealous.
You're welcome.
Thank you.
You're welcome.
Thank you.
Now get a close-up of the nose so we can do a before-after.
What?
It changed already.
Really?
It's not 100%, but it changed already. Cool. Right, sir? It changed a little bit. Right? All right. Squeeze. Squeeze. Tiny bit left on the scaphoid. Got it. Squeeze. Squeeze. It changed. You're all set.
Yeah.
Welcome to the office.
Thank you.
Questions?
No.
Okay, see you in a couple of days.
Okay, thank you.